So let us start the third class for the theory, and in this we are going to discuss factors affecting drug absorption. Then we are going to discuss bioavailability, then bioequivalence, and finally we are going to discuss drug distribution or distribution of drug. So in this first we are going to discuss the what are the factors that influencing the absorption of drug, and this is very important. And as you know, the absorption is the part of pharmacokinetic, because in pharmacokinetic it include absorption, distribution, metabolism and excretion. So this is the first one, the absorption of the drug, and very important. And the factors that govern the absorption of the drugs are, in which few we already discussed, and again we are going to repeat the same thing. So in this, the first factors that influence the absorption of the drug are physical factors. Under these physical factors, these are coming like blood flow at the site of absorption, then the surface area of the site of absorption, then the contact time of the drug at the site of absorption. So these all three are coming under the physical factors which influencing the absorption of drug. The first one is the vascularity or the blood flow which influencing the absorption of the drug. So as you know, when there is more vascularity, more blood flow, which is directly proportional to the absorption. So what it means? It means if there is more blood flow, more vascularity, then the drug will absorb fastly. So this is very important, and because of this reason, as you know, majority of the drug, when we are administering it through the oral route, are absorbed from the intestine. Why? Because in intestine there is more vascularity than the stomach. So therefore, from the intestine, drug will absorb more will absorb less as compared to the intestine. Why this vascularity is high in the intestine? Because of the presence of villi. So villi are itself is highly vascular. So because of high vascularity of the intestine, the rate of absorption of the drug as compared to the rate of absorption in a stomach is higher than the stomach. So intestine absorption is greater than as compared to the stomach. So this is very important, and this is because of the higher vascularity higher vascularity in the intestine. So this is one very important point. Second, under this vascularity is concerned, if there is shock condition. So in shock condition, this is going to reduce the blood flow at the skin or at the cutaneous tissue. So the condition like shock, it will produce the low blood flow at the cutaneous site, and therefore when we are administering the drug by subcutaneous administration, so because of low blood flow in shock like condition, low drug will be absorbed. So there are two very important points under this the vascularity is concerned. One in the high vascularity in the intestine compared to the stomach, and there is the shock condition which will reduce the blood flow in the cutaneous tissues. So these are coming under the first. Now we have to go through under the physico property is surface area. If you are administering the drug and if the surface area of the site of absorption of the drug, if the drug is here, and if the surface area of the absorption site is more, the faster will be the drug absorption. And this you can say that directly proportional to the surface area. Means the larger surface area, faster will be the absorption. And in the intestine, not only the blood supply or blood flow is more, also the surface area is more in the intestine, particularly the duodenum, particularly the small intestine, because of the presence of the microvilli. Microvilli are highly vascular and many more number in the intestine, and therefore because of the microvilli or villi present in the intestine, the surface it will enhance the surface area, which is about 1,000-fold more than the surface area present in the absorption. So you can say in the intestine, not only the surface area is higher, not only and also the blood flow is high in the stomach, and therefore you can say the both because of the more surface area as well as the more blood flow in the intestine, the rate of absorption is faster in the intestine as compared to stomach. So this is the second point under the physical factor. Now under the physical factor of the drug absorption, we have to go through the third point and the last point, the contact time. So what is contact time? As we know, the majority of the drug is going to absorb from the intestine. So if the drug will persist within the intestine for longer time interval, it will be absorbed more. And if the no drug is there at the intestine or at the microvilli, how the drug will absorb? So this is the best example, the condition like the diarrhea. In case of severe diarrhea, drug will not sustain or persist in the intestine part of the GI tract of the patient, and therefore it will pass out fastly, and therefore the drug absorption will be low in the condition like severe diarrhea. And we have to go through the other condition like if you are going to give any parasympathetic drug, then it will enhance or increase the gastric emptying. So when there is faster gastric emptying is there, so therefore drug will not sustain for longer time interval in the intestine part of the GI tract, and therefore it will reduce the absorption of the drug. And just opposite to that is sympathetic in a drug. Sympathetic drug will keep keep the drug for longer time interval in the absorption side. So these are the very two important point regarding the physical factors which influence the absorption of the drug. Now we have to go through the physicochemical property. So in this physicochemical property, the property is mainly concerned not only to the drug, but also it is concerned to the membrane. Okay, so what the property will influence the absorption of drug or will influence absorption of drug and influence the membrane that we are going to discuss. So if a size under the physicochemical property of the drug, the size of the drug is very important. So size of the drug is governed by the molecular weight. So if the size of the drug is more, so of course it will affect the absorption of drug. to a particular size of the drug, it will pass out through the either the porine, or you can say if this is lipophilic, then it will absorb. So the size of the drug is very, very important, other than the lipid solubility of the drug. If the drug is highly lipid soluble, then of course, because through the cell membrane, through plasma membrane of the patient, the drug will absorb because of the lipophilicity. And if the drug is more showing the ionizing property, if drug is easily ionized, so as you know, the ionized drug are less lipid soluble and less absorb, and this is governed by the equation Henderson-Hasselbalch equation. Then pK of the drug, and then the binding of the drug with the proteins like serum protein, tissue protein. So these are the factors which influence the absorption of drug, are the size of the drug, then pKa value of the drug, then the ionization property of the drug, the lipid solubility of the drug, and its binding capability of the drug with the protein. Only the unbound form of the drug is producing action. If the drug is more, if a drug is more amount in bound form and very less quantity in unbound form, so only the unbound form of the drug is going to produce the action. However, the bound form is not produce the any action. So these are the various physico-chemical property concerned to the drug as well as the membrane. Now we have to go through the other property which influence the absorption of drug, is the water solubility or nature of the dosage form of the drug. So what is the meaning of nature of the dosage form of the drug? If the drug is oily, then it will absorb slowly. If the drug is in suspension form, it will absorb slowly as compared to the solid form. So the if a drug is easily soluble in water, lipophilic in nature, and unionized type of property a drug have, then it will absorb easily then as compared to the other dosage form of the drug, like oily form, the suspension form, or the solid form. So dosage form of the drug is going to be influence the absorption of the drug. Suspension, that is not well soluble mixture, so it will influence the absorption, slowly absorb. Likewise, oily preparation is also absorbed slowly. So these are the various property for the absorption of drug. Next to that one, three property that are coming under the factors which influence the absorption of drug are the concentration and volume of the drug, then the route of administration of the drug, and then the last one is the disease condition of the patient. So these three factors, in addition to we already discussed, also influencing the absorption of the drug, that we have to discuss one by one. If at the site of the absorption of the drug is high, concentration is high, volume is high, then the more amount of the drug is absorbed. Take the example, if you are administering the drug through oral absorption or oral route, and in the intestine, if more concentration of the drug is present, then absorb more. Is less, then less absorb. Like parenteral administration, if the concentration of drug is more when you are absorbing, you are administering the drug, then the more concentration, more absorption, more volume, more absorption, less concentration, less absorption, less volume, less absorption. So this is very, very important. That is why the concentration and the volume of the drug at site of the absorption is directly proportional to the rate of absorption. So this is very, very important. Now we have to go through the route of absorption of the drug, that we already knowing that the route of administration is a very, very important feature for the absorption of the drug. And as you know, if you are going to administer a drug by intravenous route, the 100% drug is available in the systemic circulation. So the other route of the parenteral administration that are also having the higher rate of absorption, like intramuscular, like intraperitoneal, then the subcut and the oral. So oral rate of absorption of drug is lower than the subcut, then the intraperitoneal, then the intramuscular, that are arranged in increasing order. So highest in IV 100%, then IM, then intraperitoneal, then subcut, and then the oral. And interestingly, if you are administering a drug by oral route, the other factor are also governing this. What this is? Take the example of penicillin G. Penicillin G, or take the example of the tetracycline. Tetracycline, as you know, tetracycline is going to chelate or going to combine with the divalent metal like calcium present in the milk. So when you are administering the tetracycline by oral route, and if the milk is there and other divalent metal containing food material is there, or any divalent metal is there in the GI tract, the tetracycline is going to bind with the divalent and trivalent metal, and therefore it will chelate the tetracycline, because tetracycline is going to combine with the calcium or other divalent metal like magnesium, and it will chelate the chelate or inactivate the tetracycline. Likewise, another example, insulin. Insulin is get inactivated in the GI tract because the insulin is the protein in nature, and protein should be break in the GI tract by the enzyme like peptidase. So this is very, very interesting regarding the route of absorption of drug, which influence the absorption of drug. Now we have to go through the last under the factors that influence the absorption of the drug is disease state. Why? Because the disease state, as we know, the disease state will influence the permeability of the cell. Like in case of infection, if patient is get infected, at that time the membrane permeability get changed. Likewise, if there is any cardiovascular disease which also influence the circulation or blood flow, so therefore it also influence the absorption of the drug. So these are the factors that we already discussed which influence the absorption of the drug are physical factors, then the physicochemical factor, then the disease state of the patient, then the route of administration of the drug, then the volume and the concentration of the drug, then the dosage form of the drug. These are the factors that I already mentioned that will influence the absorption of drug. Now we have to go through the other terminology, the bioavailability, then absolute bioavailability, then relative bioavailability, that we are going to discuss this. So what is bioavailability? Bioavailability is simply the availability. How? Biologically. So the definition, if you want to define, this is very, very simple to define. The availability, the amount, the proportion of availability of the drug in the systemic circulation, in the blood stream, after its absorption is called bioavailability. If you don't know to how to define this bioavailability, you simply break the term bioavailability, available biologically, where in the systemic circulation, and you sum up these all and define that the amount or the proportion of the drug, amount or proportion of the drug that are available in the systemic circulation after its administration, either oral administration or parenteral administration, is called bioavailability. So bioavailability is the very important, because we are going to discuss about the quantitative estimation of the drug, how much drug get absorbed. Whereas in case of absorption, we simply say drug get absorbed and reach in the systemic circulation. Here we are considering the amount, proportion of the drug that get absorbed. So that is why this is very important. So now we have to go through the Now we have to go through the other terminology, and these terminology are important terminology are the again we are going to repeat the same by because we have left. So the fraction of the drug that available in the systemic circulation, and that is usually unchanged form, is called bioavailability. So bioavailability is symbolically represented by F. So this is when we are telling this, usually we are talking about the absolute bioavailability. And if we are going to discuss here two terminology related to bioavailability, that is the absolute bioavailability, another is the relative bioavailability. So we are going to talk about the relative bioavailability, and the another thing we are going to discuss about the absolute bioavailability. So when you want to calculate the bioavailability of orally administered drug, then you can say F is equal to AUC. AUC stands for A for area, U for under, C4 curve. So bioavailability F is equal to AUC after oral administration divided by AUC after IV administration. AUC after IV administration is multiplied by 100 is the formula for the calculation of the bioavailability by IV by oral administration, and this is multiplied by 100 is called bioavailability. So and this is sometimes also called the absolute bioavailability. So now we are going to discuss. So this is so what is a AUC? This stands for area under curve. When we are administering the drug by any route, we are going to plot it in on a graph. So one side of the graph we are taking time, and another side of the graph we are taking the concentration of the drug. So when you are administering the drug through intravenous route, the drug get 100% absorbed. This is the plasma concentration, and simultaneously when time is proceeded, the drugs get fall. So this whole area from this to this is called area under curve. When the same drug, when you are administering by the oral administration, so when you are taking the drug, the drug plasma concentration is, or systemic concentration is 0, and it rise slowly and slowly, and thereafter it will reach at the peak. and thereafter it will decrease slowly and slowly. So this area we are calling it the area under curve. So the formula for the calculation of bioavailability for oral administration is AUC after oral administration divided by AUC after intravenous administration multiply by 100 is called AUC for calculation of oral administration. Now we are going to talk about the absolute bioavailability, and again we are going to talk about the relative bioavailability. When we are telling the absolute bioavailability, then you can say, if you are going to tell, we are going to compare two for two form of the drug, means the active ingredient of the drug is the same. Active drug is the same, and same drug we are administering by IV route, and the same drug we are administering by oral route. So when we are comparing these two, after its oral administration and after its IV administration, we are calling it the absolute bioavailability. The availability by both the route, I mean the oral route and the another IV route, and when we are comparing the same active constituent of the drug, is we are calling it the absolute bioavailability. However, in case of when we are telling the relative bioavailability, in case of relative bioavailability, we are no doubt we are taking the same active ingredient of the drug, but the drug are in two formulation. One formulation for IV administration and other form is the for the oral administration. So this is, that is why we are comparing the two different formulation of the same active constituent. But in case of absolute bioavailability, we are not going to take the two different formulation. However, in a relative bioavailability, we are taking the same active constituent of the drug but the two formulation, and when we are comparing the bioavailability between these two, we are calling it the relative bioavailability. So bioavailability is also called absolute bioavailability, is the compare of bioavailability of active drug in systemic circulation after IV administration and after non-IV administration of the same drug is called bioavailability or absolute bioavailability, and the formula for this is the, we are considering AUC oral divided by dose oral, or AUC IV divided by dose IV. This is going to call the formula for the absolute bioavailability. So what is the main difference between the absolute and the fractional bioavailability? Is only difference, the in both the case the drug are the same, the active constituent are the same, and we are administering both from the same route, oral as well as non-oral, non-oral or IV or non-IV. But in first case, we are administering the same drug through different route, whereas in case of relative bioavailability, we are taking the two different formulation of the drug. So this is called the relative bioavailability. So this is the difference between this. So this is the some the measuring the relative bioavailability. It provide measure of relative performance of two formulation A and B. So the formulation are different, but the drug are the same, and both are reaching in the systemic circulation. And we are seeing the different formulation of the same active ingredient and measure the its bioavailability. So relative bioavailability is simply the comparison of the bioavailability of two formulation of the same drug or certain drug as compared to the another formulation of the same drug is called the relative, and this is simply the formula in case of this is the A drug, and this is the dose of the A drug, AUC of the B drug, and dose of the B drug. So this is about the bioavailability and absolute and relative bioavailability. Relative bioavailability is also called relative bioavailability is also called because we are comparing. So this is also called comparative bioavailability. Comparative bioavailability because we are comparing it between two formulation, and this is also called because we are relating, so that is why relative or the comparative bioavailability. So this is all about the, so here we are going to discuss what are the factors which influence the bioavailability of the drug that we are going to discuss. So in this, the first one is the first pass metabolism or hepatic metabolism, which govern the bioavailability. The drug solubility also govern the bioavailability, and the chemical stability of the drug, and the last one, nature of the formulation. So there are four factors which influence the bioavailability of the drug. Among these four are, all the four are very easy to recall, but among these are the first, the important one, the first past hepatic metabolism. So what is first pass hepatic metabolism? That we already discussed. When we are administering any drug other than vascular route or non-vascular route, drug reach to the systemic circulation, or before reaching the drug in systemic circulation, drug amount get metabolized is called first pass effect. Means ki if you are administering any drug 1 gram by oral route, so this 1 gram administration of drug by oral route, first it will reach in the GI tract, and in GI tract some of the drug get degenerated by the enzyme present in the GI tract. Then the 100% drug not get absorbed from this GI tract, so less amount, some amount get degenerated, some amount 100% not get absorbed, and after the absorption from the GI tract, it will reach to the liver. After absorption, it will reach to the liver. So before this through the portal circulation, so in the liver the some part also get metabolized. So in liver, some part of the drug by oral route get metabolized. In GI tract, some part of the drug get metabolized as well as get dissoluted in the GI tract. And thereafter, the metabolism and the dissolution in the GI tract, the amount reach in the systemic circulation. So the amount that present in the systemic circulation is called the drug that metabolized as well as destroy in this pathway is called first pass metabolism. So that means ki 1 gram of the drug that we have given to the animal or the patient is not always you will find less than 1 gram in the systemic circulation. So drug that get metabolized, that get destroyed before reaching to the systemic circulation is called first pass hepatic metabolism. So this is the definition of the after oral administration of the drug, before reaching and entering in the systemic circulation, drug absorbed across GI tract, enter in through the portal circulation and get metabolized in the liver before reaching to the systemic circulation. So the amount that get destroyed in the GI tract, amount get metabolized in the liver, and therefore less amount of the drug get reach in the systemic circulation through metabolism, and this generation is called the first pass effect of the drug. First pass effect. So the best example is the lidocaine, is anesthetics, local anesthetic. They get significant amount of the drug get biotransformed or metabolized in the liver. So this is, so other factors that are important for this factor which govern the bioavailability of the drug are solubility of the drug. If the drug is less soluble, less absorb, more soluble, more absorb. So as you know, usually if a drug is hydrophilic, means ki having the affection with the water, that means they are poorly absorbed, because they usually the hydrophilic drug are less lipid soluble, also get ionized. So therefore, hydrophilic drug, the drug with having the affection with water, some part get ionized, and also hydrophilic drugs, particularly the high hydrophilic drug, are also no or less or no lipid solubility, particularly of the very high hydrophilic drug. And hydrophobic drug, the majority of drug that largely are hydrophobic drug, means they don't have the affection with the water, but having the affection with the lipid, are readily absorbed from the membrane. Why? Hydrophobic drug are lipid soluble and also aqueous soluble, less aqueous soluble, and easily pass the membrane or cell membrane or lipid membrane, and therefore the hydrophobic drugs are readily absorbed. However, hydrophilic drugs, those that are very hydrophilic, are very meager amount of this get absorbed. So this is about the solubility and about the first pass metabolism, hepatic metabolism. Third one is the chemical stability, that also govern the bioavailability of the drug. How? As you know, a drug penicillin G is acid labile drug. So when penicillin G get acid environment in the stomach, because you know the stomach has the high pH, high acidity in the stomach, so the acid is going to degenerate penicillin G. So therefore, the penicillin G get destroyed by the acidic environment of the stomach. Likewise, the another drug, insulin. Insulin is a protein, and protein is only destroyed by the enzyme like peptidase. So that is also they get degenerated when we are taking it by the oral route. So both the drug like penicillin G as well as the insulin, when we are taking through the oral route, get destroyed. Penicillin G by the pH, low pH, and insulin by the peptidase like enzyme present in the GI tract. Now under this bioavailability, we have to go through the last one factor, that is the nature of the drug, that we already discussed in the one of the property of the factors in the absorption of drug, that its size of the drug, then the salt form of the drug, then its lipophilicity of the drug. So these all are coming under the nature of the drug, that which govern the bioavailability of the drug. Now we have to go through the bioequivalence, and this term is also quite related to the bioavailability. Here, this is also the similar to the bioavailability, because we are talking also here the availability of the drug in the systemic circulation. But In case of bioavailability, we are only talking about the amount available in the systemic circulation. However, in case of bioequivalence, we are comparing the availability of the drug in systemic circulation uh, in comparison to the same formulation or same constituent. So we are comparing here the amount of two different formulation, whether these two formulation of the same drug, their concentration are not significantly varied at a particular time, then we can say the drug are bioequivalent. So bioequivalence means the bioavailability of the active constituent of the drug comprising or the bioavailability of the active constituent of two formulation in which both the concentration of the drug in the systemic circulation are not significantly variable, then we can say they are the bioequivalent. So the two drugs are said to be bioequivalent if they show comparable bioavailability at the same time and they achieve the peak blood concentration. Or you can say the two pharmaceutical equivalent drug product are considered to be bioequivalent when the rate and extent of the absorption of the rate and extent of bioavailability of the active constituent of two products are not significantly varied is called bioequivalent. So the rate and the extent of bioavailability of two pharmaceutically equivalent drug product are not significantly variable, we are going to call they both are bioequivalent. And if the two drug, usually we are saying two drug, then usually their active constituent are the same. Their active constituent are the same. They are not varied, but their formulation is variable and their concentration at the same time are not significantly vary is called bioequivalent. And if we are talking that they are therapeutically equivalent, at that time their efficacy and safety are same of the two similar drug of different formulation, we can say are therapeutically equivalent when they are not significant variable or if they are comparable in efficacy and safety is called therapeutic equivalent. And when we are telling the two drugs are pharmaceutically equivalent, when the active ingredient are same, their strength are identical, their concentration are also identical, their dosage form are also identical, and the route of administration of these two are also identical is called pharmaceutical equivalent. Now this is all about the factors governing the absorption of drug that we already discussed. Also discuss what is the bioavailability and what are the factors which influence the bioavailability of the drug. We already discussed absolute and the relative or comparable bioavailability. We already discussed pharmaceutical, therapeutical, bioequivalent, and now we have to go through the last under this is the drug distribution or distribution of the drug. So drug distribution or distribution of the drug is nothing. This is simply when your drug is available in the systemic circulation, and from this systemic circulation the drug is distributed into the interstitial space or interstitium or within the cell is called distribution. So distribution of the drug is nothing, is simply process of reversible drug distribution or reversibly drug leave from the bloodstream or systemic circulation or central compartment. So distribution is simply reversible transport of the drug from systemic circulation or bloodstream or central compartment, and which enter in the interstitium or inter means between interstitial space in which the extracellular fluid is there, and also within the cell. So from the blood circulation it will distribute amongst the different part of the body, and in the fluid is simply called the drug distribution. So now we have to go through the factors which govern the distribution of the drug. So similar to the factors which govern the absorption of drug as well as the bioavailability of the drug, you will find some of the point that some of the factors are very common, like blood flow. So if the blood flow is more, so of course the distribution of that particular organ is more, means ki actually what will happen, this heart is supplying the blood to the different organ, different cell. So once the drug reach in the systemic circulation, from there the drug will be distributed among different part of the body, and the different part of the body itself have the different circulation, because heart is going to supply different amount of different volume of the drug to different organ, like liver, like kidney, like brain. They are highly vascular organ, their blood supply is more, and therefore in highly vascular organ like liver, like kidney, like brain, the drug will distribute from the systemic circulation, from the central compartment very fastly. So it will, so blood flow, then the capillary permeability. Second is the capillary permeability. So if a blood vessel of the systemic circulation, if the capillary is more permeable, so drug will pass out easily to other place. If the less permeable, the drug will produce less. So the capillary permeability is also influencing the distribution of the drug. Next is then the third one is the fourth we already discussed about the hydrophobicity. As we know, if a drug is hydrophobicity, means lipid soluble. Lipid soluble drug easily pass out anywhere in the body. So this fourth point that we are not going to discuss much more because we already discussed. The third one is the binding capability of the drug to the plasma protein or tissue protein. What it means, as you know, in systemic circulation, albumin is there. So, if a drug, so this is the systemic circulation. This is the systemic circulation, and this is made up of endothelial cell. Like this, in this is the endothelial cell. This is the endothelial cell. So, if the gap between two cell is more, so the drug will pass from the systemic circulation, drug will pass through the blood very easily. If this is called slit junction. So if the junction between two endothelial cell is very complex, as the blood will not move out, and slow circulation will occur, and therefore less drug will reach. So the space between the endothelial cell is a determining factor for distribution of the drug. Why? Because this is the systemic circulation, and in systemic circulation blood is there, and blood is having the drug, so drug has to be distributed. So if the slit is narrow, drug will distribute slowly. If the slit is more, the drug will distribute fastly. If the capillary is more, if here the capillary is more, so the tight junction is there, so drug will distribute slowly. So this, and regarding protein binding is concerned, so here in the systemic drug, in the systemic circulation, if a drug is highly protein bound drug, then the drug is going to bind with the albumin present in the systemic circulation. So when a drug will bind with the albumin protein of the systemic circulation, the size become bigger. So drug will automatically distribute slowly. So this is very, very important factors that govern the distribution of drug that we are going to discuss one by one. So first one is the blood flow that we already discussed. If more blood flow, more drug will be distributed in that part, and in that we already discussed the brain, the liver, the kidney having the greater blood flow as compared to the skeletal muscle. However, the skeletal muscle and fat tissue are having less blood supply, so drug will reach slowly there. But if the if a drug is lipophilic, then of course it will reach in the fat tissue also because of the lipophilicity nature of the drug. So adipose tissue also lower the rate of blood flow. Example is thiopental. Thiopental is a lipophilic anesthetic and also soluble, and lipophilic means soluble in lipid. So if you are administering the thiopental, that is a lipid soluble drug, it will reach fastly in the uh, organ which have the high blood flow like liver, brain and kidney. Thiopental has to produce the anesthetic effect when it reaches to the central nervous system. So as you know, the brain is the having more blood flow, so drug will reach fastly there in the brain and produce the local anesthetic, produce the anesthetic effect. But what will happen once the drug will reach in the CNS from the systemic circulation? So this will reach in the brain, and from the systemic circulation, and from the systemic circulation drug also have to distribute the area that we call the redistributed area, where drug is not going to produce action, like the skeletal muscle, like the fat tissue. So what will happen if drug is present in the systemic circulation? Their concentration is slowly decreases because drug will not reach in the brain at the site of action to produce the anesthetic effect, but also reach in the area like a skeletal muscle, and because this is lipophilic, it will also reach in the fat tissue. So their concentration is get lowered in the systemic circulation. So what will happen? The drug will again come out from the brain to the systemic circulation to maintain the concentration in the systemic circulation. So therefore, the concentration of the drug in the brain get reduced to produce an aesthetic effect, and therefore the drug like thiopental is the short acting, because the drug will not sustain its therapeutic concentration in brain for longer time interval because of its redistribution in fat and skeletal muscle, and therefore their activity is for the lower time. Now we have to go through the capillary permeability that we already discussed, because if we are considering that if a drug is going to be distributed from the systemic circulation, so this is the systemic circulation. Here is the another organ. Take the example like liver. So through capillary it will reach there. So and from the capillary this is also going to distribute in the liver. So if the capillary is more permeable, then the drug will distribute very fastly. And if the capillary structure is very compact to distribute the drug, then the drug will not distribute to that particular organ. Take the example of the brain or the capillary structure in the brain. As you know, the brain have, before reaching the drug, have a capillary structure we are calling BBB, blood-brain barrier. So capillary structure of the blood-brain barrier is not possessing slit between the endothelial cell. No gap, less gap, very narrow gap between the two endothelial cell in the capillary structure of the blood-brain barrier, and therefore drug will not easily pass out to the brain because BBB capillary structure, blood-brain barrier capillary structure, as because of the slit, because of the gap between the endothelial cell is very small, drug will not pass easily. So therefore this structure is very important, and you can say this is quite selective. So blood brain barrier, capillary of the blood brain barrier, drug will not enter easily there because of the absence, or you can say the tight junction is there, and slit is very narrow or even absent, and capillary are tightly juxtaposed and tight junction is there, so drug will not reach easily in the brain because of the capillary intactness. So this is about the capillary structure. Now we have to go through the other factors. We are also going to discuss the drug structure that we already discussed. Hydrophobic drug are lipophilic in nature, readily cross the biological membrane. That we already discussed. If a drug is hydrophobic, means the heat from the water, that are usually lipophilic. So lipophilic drug easily penetrate the membrane, and the hydrophilic drug is not readily going to penetrate the cell membrane because they are not not lipophilic in nature. So that is why. Next point under the factor which influencing the distribution of the drug is the binding of drug to the protein. That is very interesting and important. As you know, we already discussed if a drug is present in the systemic circulation. So this is the drug, and if a drug is possessing high protein binding capability, so drug is going to bind with the protein present in the plasma, that is the plasma albumin. So drug is having the higher potency to bind with the plasma protein, that is albumin. Drug is in bound form, not in free form. So their size become bigger. So if the size become bigger, the slit between the two endothelial cell, in this bind form will not easily pass out because the slit will check it because of its size. So therefore drug will sustain or retain in the systemic circulation or anywhere on in the blood vessel where it is in bind form because of its size. So therefore if the drug get dissociated, get separated from the albumin, plasma albumin, then the size become the small and then easily pass out, then become working. So this is plasma protein binding. If a drug is plasma protein bind, they are less active, not working, because the first important point is that free drug are inactive. Why? This is being bound form. So free drug is not available to produce its action on the target. So, and this plasma albumin is also called drug reservoir, because in the systemic circulation, drug is going to bind with the plasma protein albumin, and that is going to act as a drug reservoir, and that systemic circulation only release the drug when the bind form of the drug get dissociated and freed in the circulation, then it will be distributed amongst in different part of the body. So this is another factor. So this is all about the seventh and last class.